Churg-Strauss Syndrome, or eosinophilic granulomatosis with polyangiitis, is a rare autoimmune condition characterized by small to medium vessel vasculitis, affecting various organ systems. This condition is most commonly seen in patients with asthma and allergic rhinitis, and its hallmark feature is an elevated level of eosinophils. Churg-Strauss syndrome typically progresses through 3 stages. The first stage is the allergic phase, where patients develop symptoms like asthma, allergic rhinitis, and nasal polyps. This stage can last for several years before progressing to the next phase. The second stage is the eosinophilic phase. Here, patients experience a dramatic rise in eosinophils, leading to tissue damage. Common manifestations include peripheral eosinophilia and eosinophilic infiltration of organs like the lungs and gastrointestinal tract. This can result in symptoms such as coughing, shortness of breath, and even gastrointestinal pain due to eosinophilic gastroenteritis. The third and final phase is the vasculitic phase. During this phase, patients develop systemic vasculitis, where the blood vessels become inflamed, leading to organ damage. Symptoms depend on the organ systems involved. For example, the skin may develop palpable purpura or nodules. The heart can be affected by myocarditis, and the nervous system may exhibit peripheral neuropathy. It's crucial to recognize this phase early, as vasculitis can be life-threatening if left untreated. Diagnosis of Churg-Strauss syndrome is based on clinical criteria, laboratory findings, and imaging. Key diagnostic features include a history of asthma, eosinophilia greater than 10% in the blood, and the presence of systemic vasculitis. In some cases, a biopsy of affected tissues, such as the skin or lung, is necessary to confirm the diagnosis and demonstrate eosinophilic infiltration or vasculitis. Treatment of Churg-Strauss syndrome primarily involves immunosuppressive therapy. Corticosteroids, such as prednisone, are the mainstay of treatment and are highly effective at controlling symptoms in most patients. For more severe cases, or when patients have life-threatening organ involvement, additional immunosuppressive agents like cyclophosphamide or biologics like rituximab may be required. Recently, biologic therapies targeting eosinophils, such as mepolizumab, an anti-IL-5 monoclonal antibody, have shown promise in treating the eosinophilic phase of the disease. These targeted therapies are especially useful for patients who are steroid-dependent or have refractory disease. In summary, Churg-Strauss syndrome is a rare but treatable condition that requires a high index of suspicion for diagnosis, especially in patients with asthma and eosinophilia. Early recognition and treatment with immunosuppressive therapy can prevent severe complications and improve patient outcomes.